Hello, and welcome to part 3 of 4 of Unpopular Opinions, Lyme Disease Treatment Should Not Be a War Zone. If you haven't seen the previous video or videos, I urge you to do so to provide the best experience and understanding of this full video project. All the previous videos are linked in the description. Before we jump into COVID-19 and the new Lyme disease research, I want to remind everyone watching that while giving feedback on your feelings in the comments is good, using the comments to mass essay post, be aggressive, gaslight, or manipulate is not. If your comment does not follow these 3 rules, it will be deleted or removed. I understand personal beliefs can lead to difficult discussions. If done with the intent to help someone understand your perspective while being open and understanding their perspective, it can be great. But these conversations should happen outside of the comments section. If you want to have a longer discussion with myself or another commenter, reach out to them privately and respectfully to engage in a further conversation. After the COVID-19 virus led to millions of illnesses and hundreds of lockdowns all over the world, starting in March 2020, with some staying in effect till October 2021, the race to mitigate the spread, reduce symptoms, and create a vaccine was on. While the study and opinions of COVID-19 proper treatments are just as divisive as Lyme disease, what happened during the COVID-19 pandemic was an explosion of research and research funding. In a report done in March 2023, it was found that 34 NIH, or the National Institute of Health, funded research grants that were directly related to the mRNA COVID-19 vaccines were identified. These grants, combined with other identified U.S. government grants and contracts, totaled to $31.9 billion American dollars, which at the time was 26.3 billion pounds and 29.7 billion euros. Of which 337 million were invested in the pre-pandemic. After several vaccines were approved and administered, a new trend was occurring. People who had tested positive for COVID-19 were showing long-term symptoms, including some not typical to an initial COVID-19 illness. This came from both vaccinated and unvaccinated populations. In an article published in April 20, 2023 by Stat News, the U.S. Congress allocated $1.15 billion to the National Institute of Health, or the NIH, to study what was now named Long COVID in December 2020. The first clinical trials were announced to start in fall 2022 after receiving the funding, and that NIH has partnered with Duke University to perform them. But it wasn't until October 2022 that Duke University said the clinical trials would actually begin in early 2023. This continued with Duke pushing back the date to the summer of 2023, while the NIH stated they would not pursue more funding. This lack of clinical testing drew criticism from medical experts and the signed-up patients to the NIH Recovery Long COVID program. The article states, the National Institutes of Health hasn't signed up a single patient as of April 2023 when this article came out, to test any potential treatments, despite a clear mandate from the Congress to study them. They continued, and the few trials it is planning already have drawn a firestorm of criticism, especially one intervention that experts and advocates say may actually make some patients' long COVID symptoms worse. The article continued that faster progress is possible. A similar study at Stanford, which received funding directly from Pfizer, was also announced in October 2022, but has already begun recruiting patients. This trial was able to be more flexible and get the study started faster in comparison to the recovery program because it's smaller, said Uptender Singh, the study's principal investigator. Singh and her colleagues are only testing Paxlovid, and doing so at only one location, rather than comparing different treatments. Of the 1.15 billion funds, almost 67% of that was allocated for research of long COVID, while about 14% was used for clinical trials. However, in a publication by the NIH, they changed their mind about requesting more funding, and in February 2024, the NIH received an additional $515 million, to which in March 2024, the NIH announced a clinical trial for long COVID to test treatments towards symptoms of heart rate, dizziness, and fatigue. With the NIH's slow and disorganized pace, the Stat News article provided frustrating feedback from patient advocates and biotech executives. Lauren Stiles, a patient advocate who serves on several recovery committees, stated, "There's a complete lack of transparency. When we ask who made this decision, they won't tell us. While Axela CEO Bill Hinshaw said, "You have to understand what you're trying to tackle," so we support that, of course. But as patients will tell you, we want intervention, not observation. His Massachusetts-based company has gone all in on testing a drug candidate to treat long COVID symptoms without any help from the NIH. When I was reviewing the history of long COVID research and the articles giving feedback on its treatment progress, I felt a very strong correlation and connection to the researchers, pharmaceutical companies, and patients' experiences of long COVID and those trying to treat long-term symptoms of Lyme disease. Well, in October 2023, so did the CDC. In October, the CDC released a new page on their website titled Chronic Symptoms Following Infections. This page showed the following information: some disease agents that have been linked to chronic symptoms, with the BB bacteria that causes Lyme disease on that list. Now, the original page posted in October no longer exists, and I was unable to take a screenshot of it at the time, but here is the page which was updated in May 15, 2024. While the CDC now acknowledges that there can be chronic symptoms after an infection is initially treated, in regards to Lyme disease, they still attest to the post-treatment Lyme disease syndrome, or PTLDS, and that its cause is currently unknown. They discourage the use of the term chronic Lyme disease because the bacteria is no longer in the body, and the resulting symptoms could be caused by the body's autoimmune condition. However, in 2017, even before long COVID research, the NIH, National Institutes of Allergy and Infectious Diseases, found that remnants of the BB bacteria remained in mice and non-human primates after antibiotic treatment. While in 2018, they started research to use live disease-free ticks to see if Lyme disease bacteria can be detected in people who continue to experience symptoms such as fatigue or arthritis after completing antibiotic therapy. These two studies and their results seem to align more with what the CDC's next paragraph was after the discouragement of using the CLD title. They said, regardless of the term used, prolonged symptoms can have a devastating effect on a person's life. There is a critical need to better understand the causes of prolonged symptoms in people who have had Lyme disease and the best approaches to treatment and care. This is my favorite and I feel the most important paragraph of everything I've researched and reviewed. The acknowledgement that the focus should be on the need to understand the cause and symptoms. This train of thought should lead to updated diagnosis and testing criteria for the CDC, NIH, and the IDSA, increased coverage provided by government and private health insurances, which includes affordable, accessible, and safe treatment options. There should be more understanding and funding for research for medical professionals on both sides of both theories. Those that believe symptoms are caused by the body's autoimmune condition post-treatment, and those who believe the bacteria is still alive and causing the symptoms. Some of these recent studies that support the theory that the bacteria lives in the body after treatment include better understanding of how the bacteria persists after antibacterial treatments, new disease detection approaches, improved diagnostic models for all chronic infection diseases, and a possible new Lyme disease vaccine. In 2023, a study about the growth pattern of bacteria and bacterial persisters showed how between the growing stage of bacteria, the exponential phase, to the death of the cell of the bacteria, stationary phase, can escape antibiotic treatments to remain alive or dormant in the host body. In 2020, Dr. Neil Spector from Duke University investigated a possible overlap between Lyme pathogens and cancer. His team worked to allow the ability to see Lyme disease through non-invasive imaging. More recently, they discovered that the Borrelia bacteria uses a HTPG proteins in a similar manner. Professor Tim Hasted from Duke University, who continues this research, and his team is currently working on identifying the BB infection using a small molecular imaging probe. In 2019, Dr. Richard Horowitz introduced a proposal for a multifactorial model for treating chronic diseases, including PTLDS and CLD, which identifies up to 16 overlapping sources of inflammation and their downstream effects, which he called Multiple Systemic Infectious Disease Syndrome, or MSIDS. At the end of the article, he concluded that an integrated interdisciplinary systems biology approach described in this study may help us better understand Lyme and associated diseases. Based on published scientific data, we need to examine the role of multiple infections and environmental toxins in neurodegenerative diseases. along with other factors of the MSIDS map that increase inflammation and cause downstream effects, including immune suppression. In regards to a vaccine, the Time magazine article reported that a new Lyme disease vaccine is in the final stages and is being co-developed by Pfizer and Valneva SE, a French biotech company. It is very similar to Lymerix from the late 1990s, but it targets 6 strains of Lyme bacteria, not just those common in North America, but in Europe as well. Instead of a single strain that Lymerix targeted, Thomas Lidenbach, president and CEO of Valneva, stated that, "I do believe that post-pandemic, the world is going to have a higher awareness of vaccination, and hopefully this will positively contribute to the acceptability of the vaccination globally."